And if you guys
So
have any questions, feel free to type them into the chat box at the bottom of your screen. And then we'll keep an eye on those questions and answer them as we go.
Start by introducing ourselves. I'm Josie.
I'm Kaylee.
And I'm Sobia.
And we're going to be teaching you, going through some things about COVID-19. With so much that's going around in the media right now and on the news, it can be really overwhelming knowing what to believe and what to do. So we're just kind of going to go through some things, facts and all that good stuff. So COVID-19, there's a lot of talk that it's a new virus, but actually it is not. Coronavirus is a type of a common virus that can infect your nose, your upper throat, sinuses, all those things, and it spreads much like a cold does. So there's a really good chance you've had a coronavirus in the past and just haven't known it. Everyone usually gets one once in their life, usually as a child. Most coronaviruses aren't dangerous, but some are. A novel coronavirus such as COVID-19 is one that is new that hasn't been previously identified. So for this one, COVID-19, it is a new one, and it is named after, if you take the first two initials in corona, so CO, the V in virus, and the D in disease, and it was discovered in the year 19. So that is where COVID-19 got its name from. And yeah, so that's COVID-19. It's not a new, coronavirus isn't a new thing, but COVID-19 is a newly discovered form of a coronavirus. Here are signs and symptoms. Sometimes it's hard to differentiate between if you have the cold, if you have the flu, or if you have coronavirus. Some of them are pretty common. The big difference is how long they last. So for coronavirus, your symptoms are going to be lasting about 14 days. For a cold, it's about a week, sometimes longer. That one has a pretty big range. And then flu is about 5 to 7 days. With the flu, your symptoms, the really bad symptoms usually only last about 3 days. But for coronavirus, they're finding them to last a lot longer. So coronavirus, the big one is a fever. You want to be monitoring if you start to get a tickle in your throat or you feel really tired all of a sudden. You want to monitor your temperature every day. Make sure it's not going up, and if it is, we'll discuss later on, that's when you want to reach out to your doctor. With coronavirus, there's not sneezing usually involved with it. With a cold, that's pretty common, and especially here in Texas, it is allergy season, so a lot of people are getting worried if they're having kind of a tickle in their throat and sneezing, but I know we're all scared to sneeze in public now too, thanks to the allergies, but sneezing isn't usually involved with coronavirus. Sore throat sometimes is involved, and another big one with coronavirus is the shortness of breath. So if it's difficult, to go up a flight of stairs that you would normally be able to, that could be an indicator that something's going on with you. Yes, so there's that one. And then the virus is spread airborne. So what that means is that it's very small particles when you cough or when you sneeze that come out, and that is how it infects another person. So that's why it's so important right now to wash your hands, not touch your face, not rub your nose, your eyes, anything like that, because if you've gotten in contact with those particles, then you're putting them into effect with yourself. So it's mainly spread person to person through respiratory droplets when another person, infected person, coughs or sneezes, and they can land in the mouths or noses of people nearby, or they can be inhaled, which is why they're recommending you stay at least 6 feet away from another individual. So social distancing. And it's starting to spread community-wise. It used to just be if you were infected with someone traveling or taking direct care of someone, but now they're finding community spread, which means it's a geographic area that you're in. So for example, here in Austin, the college community, West Campus area has a community spread because those individuals were together in close contact, and it's just traveled that way. So another big thing with how it's spread that's going around is with food products, and if you're getting delivery or getting carry out, can you get it that way or not? Right now, there is a study that's found that it can live on hard surfaces for 24 hours to 3 days, but there hasn't been evidence to support the transmission of getting COVID-19 with food delivery. It's always recommended that before preparing food or eating food that you wash your hands for at least 20 seconds, use hand sanitizer, make sure you're following standard procedures to keep yourself safe. But right now, there's no proof that getting delivery or carry out will cause you to get the coronavirus. And they're finding that it does live on surfaces such as stainless steel for up to 3 days. So it's recommended to just use the disinfecting wipes and the spray that way. And then the next topic we'll talk about is if you're at risk. So those that are over 65 are going to be a high risk, as that's been in the news quite a bit. So that is the population that's going to be at a high risk. Any healthcare workers, those that are taking direct care of someone who's been diagnosed with COVID-19, if you've been in close contact with someone, if you have traveled and returned from a community that did have a spread, those who have other chronic medical conditions, so such as asthma, diabetes, any heart disease, severe obesity, liver and kidney disease, that will put you at a higher risk. And people who live in a nursing home or long care facility are also at a higher risk. So next we'll have Sylvia talking about the next topic.
Hi, my name is Sylvia again. So how is it diagnosed? So right now, to diagnose the test that we're using is a swab that goes in your nose. I don't know if we have that photo of it. Like right there. So it does go back kind of far. It's a little bit uncomfortable, but that along with a combination of symptoms like Kaylee was saying, if you have that dry cough where there's not a lot of mucus or anything coming up, it's just kind of dry, no phlegm or anything, fever, or even that shortness of breath, altogether those combination of tests or how they diagnose COVID-19. And so when it comes to testing, not everyone displaying symptoms should be tested. A lot of people have milder symptoms, meaning that, you might have a cough or a slight temperature, but your body's kind of working through it and you're not going to have that big full-blown reaction that other people are having. And so sometimes you can recover at home. You can self-quarantine and work through it, like Kaylee was saying, in those couple of days, a week or so, until you get better. Especially since we don't have a lot of access to tests right now, it's really hard to get that out to everyone. And so if you're not having that huge reaction, it's probably best for you to just not get a test and stay home and try and recover. Later on, we'll talk about when you should go and get tested or go to the emergency room. And then other options that you have if you are feeling sick and you think you might have it is having a telehealth appointment. And so what telehealth is basically seeing your doctor just through the computer, kind of like what we're doing now. And we have a couple of resources that I think maybe Dr. Horton can send out of places you can go or offices that are offering telehealth appointments. And basically you just see your doctor over the computer or over the phone. And you can talk to them about your symptoms and they'll kind of give you some idea of what it is you should do, whether it is to leave home or to go to the hospital and seek treatment there. And so, Dr. Horton will send you guys that link of the different places you can go and different options that you have for telehealth and whether or not you should be tested or not. Next, what we wanted to talk about was if there's a cure, and then also just what kind of myths or things that you've seen on social media that maybe aren't true. And so as of right now, there is not a cure for COVID-19. I do see we have a question. Oh, yes, thanks. So right now, there is not a cure for COVID-19. It's still in the process of finding one. We're also looking at different vaccines. From what information we have now, it looks like there won't be a vaccine that'll be available to the public for this for at least another year or so. Again, that could change because things are still happening and changing every day. And so in the meantime, like we said, for people who are having a COVID-19 infection, the best thing you can do is to just stay at home, drink lots of fluids, take Tylenol for your fever or any body aches and things like that you may be having, and just try to alleviate the symptoms of it until your body can fight it off on its own. That's kind of the best way to cure it or treat it right now. I know later on we'll open it up for you guys to ask more questions, or maybe to ask about different things you've heard that might help it. But just some of the things that we've seen as far as myths that we kind of want to debunk are things like warm air, using a hair dryer in your nose, drying things up will help prevent it. It won't. And then let's see, what other things have we seen? Drinking salt water or warm water to try and prevent the virus from getting into your lungs or moving into your stomach or something like that. It's not typically how the virus itself works or how it is killed. So we wouldn't recommend just solely using those methods. And let's see. Next, if there are any other questions or things that you've heard that you kind of want to clarify, please put it in the chat, or at the end we're going to open up your mics, and that way we can kind of address your concerns personally. But the next topic that we have is what to do if you or your family member feels sick. And so like we were saying, the most important thing you can do is to, if you start feeling sick, self-quarantine, stay home, and try to work through those symptoms as they come. And so another important thing is to kind of look back on anybody that you've had contact with over the last 2 weeks. So with the COVID-19, you cannot show symptoms and actually have it for up to even 2 weeks. And that's why we recommend that if you know that you've been in contact with other people in your family, maybe whoever's in your home, or you know, someone that you may have met up in the past 2 weeks before all the stay-at-home orders happened, we do recommend that you get in contact with them, let them know that, you know, there's a possibility that, you know, you may have infected them, or maybe they had infected you, and just to let everyone know to stay home in order to minimize any more infection. We don't recommend that you go to the emergency room right away. If you do have difficulty breathing, like Kaylee was saying, if maybe you take the stairs or you go on walks every day and you start noticing that you're having a harder time breathing during those times, that might be an indication that things are getting more serious and that you should go to the ER or call your doctor, do those telehealth appointments like we were just talking about. Otherwise, the most important thing is to quarantine yourself maybe into just one room and try to avoid sharing household items as much as possible until you're starting to feel better. And then, like we said, drink lots of water, take that medication to help alleviate your symptoms. And wearing that face mask, I think, is now something that the Surgeon General has recommended. So the face mask itself is not only to protect yourself, but to protect other people. So if you do think that you may have it, it might be important to wear that mask so that you don't spread it to others, especially if you're in a home with more than just yourself. And so the Surgeon General recommends now that if you do have to leave your home to go grocery shopping or do or work or anything like that, to please wear a face mask. And I know that it's really hard to come by those face masks right now. And so you can make some at home or use your scarf or other cloths to cover your face. But most importantly, you want to make sure you're also covering your nose because that is an access point for the virus. And make sure that it covers under your chin as well so that nothing can come in from like those openings. And then we have Josie here to talk a little more about it and to give you some examples of ways you can make your own.
Okay, so yes, lots of ways that you can make your own mask. If you happen to be a quilter, avid sewer, you have your own sewing machine, there are lots of places online where you can find patterns, and if you're aware of how to do that, that's fantastic. Most of us don't fall under that category. So here are some alternative ways that you can still protect yourself and still find ways to protect your nose. Can you guys still hear me? Uh-oh. Can you hear me?
Yeah, Josie, we can hear you.
Okay, my cat, I think, may have done something to my screen. Okay, so so one thing you can do, we found an article that stated that the best ways for us the best materials to protect yourself are with sweatshirt material and towel material. So if my husband went and found this really cheap at Walmart 9-pack of dishcloths. That's a towel material.
Josie,
yeah.
I'm going to interrupt for 1 second.
Sure.
I'm going to have y'all unshare the screen just for a second so Josie will be on the screen so people can see her and not scroll through their sidebar.
There we are.
And then you can share after she shows.
Am I in the middle? Okay. So this it's super cheap at Walmart, this 9-pack of utility cloth. And then I also found an old hoodie that I ended up cutting the hoodie part off. And what I did is I just cut a little triangle and then used safety pins, and I took the hoodie part, the string, and I attached it to the top, and it's this particular hoodie happens to be double layered. So it doesn't have to look pretty, the edges aren't pretty or anything, but, it's going to work. So you can use it, you can use it like this, and you don't want to sew it or anything or do it until you've actually tested how far away your ear is from where you need your protection, right? So you want it to be as tight as you can get it under this area as well as up here so that as little can get in as possible, right? So putting this, attaching it there. So this one I happen to sew. If you have basic needle and thread sewing abilities, you can sew just that little part on there, but keep this one so that you can adjust it every time that you need to, especially after you wash it. Things change and you do need to wash it after every use. Then you can use the safety pin to make sure that it still fits properly every time you put it on. So again, just putting it this way, and then you can kind of see how far you need it in order to make it stay. And then take it off and then just safety pin it on there. Okay, again, doesn't have to look pretty, it just has to do the job, right? So for the towel one, what I did is I took one towel and I cut it in half, triangular wise. These are just like small dish towels, right? And this one requires no sewing of any kind. What I did was I took hair ties and I wrapped the corner of the towel. I put the hair tie around it and then wrapped the corner around it and then safety pinned the two pieces of material together around the hair tie. And what's good about the hair tie is it, has some buoyancy, so you can, kind of have a little tighter, and you can have this part up or not. I found with this part up, it was too easy for it to fall down. So I actually think it's better with the middle part that I cut at the top. And then you have two hair ties, and you can kind of, cinch that in to make that area a little tighter. And it's covering this area, and it's covering up here. And it fits pretty snugly. And you can breathe perfectly fine through it. I mean, I wouldn't want to work out with this thing on because, it's a little bit of a problem, but you can breathe through it just fine. And you just put more or less fabric through the tie, and it'll be tighter to your face. And like I said, with these, you can make 18 of them. So you can make a whole big old family worth of them, or make a new one for every day if you need to. And then if you really don't even want to use a safety pin, and you want to use something that's more like a t-shirt material, these are men's briefs straight out of the package. I wouldn't recommend used ones necessarily, but straight out of the package. What you're going to do is you're going to stick your head inside one of the leg loops. This is going to be your face mask part. You can put it over your ears. It's going to look a little burqa-like, but you can put the back, and you're completely protected. Breathe just fine. Now, this is not the best material. It's a little porous, but it'll still do the job. Okay? And that has no sewing or safety pin or anything required. But again, fresh out of the package. And then make sure you wash it. All right, any questions?
Okay, I'm gonna unmute everybody so people can ask questions. And if you're calling in on a phone, you might have to hit *6 to be able to ask your question. And it looks like the phone person wants to ask your question. Go ahead.
I have a question. Oh, I know we're doing stay in place, but if you just want to go for a walk around your block, then we should still wear the face mask to do that?
Yeah, so right now the recommendation is if you're going to leave your home, because like Kaylee was saying, it's airborne. And so those particles and everything, they can stay in the air for quite some time, as far as we know now. And so it's just to be safe for yourself and for other people, just to wear that mask on your walk. And I know it is uncomfortable, kind of like Josie was saying, and hard to breathe if it's not, like if you're wearing like that big towel or like a big t-shirt, it might be uncomfortable to breathe, but as best as you can, try not to mess with it too much, because once you start touching it, the outside of it, you don't know what you may have walked into, and then it's on your hands, and it's kind of a natural thing to touch your eyes or to bring it down a little and scratch your nose, and so just for your safety and for everyone else's, just to wear that mask if you have to go outside.
Yes, and to also add to that, when you come back inside, you should take baths, and because the virus is sensitive to soap and water, so you should take baths anytime you're out in the elements and come back in, take a bath.
And like the best way to take it off is from your ears, whatever mask you decide to wear. Take it off from your ears, because like we were saying, you don't know what might be on the mask or what you may have touched and then touch the mask. And so just to protect yourself, you could take it off by the ears and then throw it in the washer, and put on your new one after that.
If you have a paper mask, can you spray it with Lysol after you use it? Like one of those paper masks, painter masks?
That's a good question. I know that I don't know the scientific fact behind it, But I think if that's all you had at the time, I think that would be a good way to try and disinfect it, would be to spray it.
Okay.
As long as it's not something that's gonna tear, like some of the surgical masks, like if you got it wet, it could, you could get little tears in it that maybe you could see or maybe you wouldn't. So you would want to make sure it doesn't get too drenched. If it's one that's kind of like mixed, kind of like plastic-y and papery, maybe it would do a little better with the spraying. But yes, just being careful that there aren't little holes in them.
Okay.
I agree. I was gonna say that once it gets wet, it's more likely to tear, and those micro size holes, it can still get through it. So if you don't have anything else, I would rather you make a cloth one than spray it and it gets wet and tears.
Okay.
Now, seeing that you said that the particles are airborne, do they travel far from wherever they originated from? So if I just go and sit in my backyard, do I have to wear a mask or?
Yes. They still recommend, I'm sorry, students, go. Sorry.
No, you're okay. Yeah. I mean, there's still, because it keeps changing and they're still discovering it can travel further and last longer. That's why they've added, anytime you leave the house, wear a mask. I mean, I know I'm going to throw myself under the bus here, and I didn't wear one when I walked outside earlier, but the CDC is recommending that you should wear one anytime you leave your indoor house. Yeah.
I got an announcement from my military unit that our families and I are required to wear it. And so that's why I support it too. Because you think about wind gusts, if your neighbor 2 houses down, he or she, they're 6 feet away, but that wind can pick it and carry it 2 fences over, and it's still an hour in the air. So
It lasts an hour in the air?
My goodness.
Well, it depends. I'll go look it up. I don't want to fib.
Are we getting to the point where we have to duct tape our windows?
Not yet.
Hopefully we don't get there.
Hopefully we don't. I need to go get duct tape now. No,
I know.
But we're not at that point yet. Any other questions for them?
I have one question.
Okay.
I've heard that ibuprofen is not good to take if you're having symptoms of headaches or pain.
Take that one.
So as far as we know right now, there's no link that ibuprofen is bad for you in relation to the COVID-19. Sometimes it just upsets people's stomach. So like just on its own. So I don't know if that's maybe where like it came about, but as of right now, there's no like studies or anything that says that you shouldn't take it. So if it helps you, if ibuprofen typically helps you, then I would continue to use it.
Okay, thank you.
Mm-hmm.
Yeah, another piece of information that floats around out there is that if you do get the fever, you should want to have the fever because the fever kills the germ. Is that true or not?
Yeah, fever is a natural thing that your body does to fight off infection. So it's a good thing when you get a fever. By masking it, you're just kind of letting yourself feel better by getting rid of the fever, but your body's still doing the process it needs to fight off the infection.
And it looks like we have a question from Tisho. It says, good morning, I'm an essential employee, so I go to my office twice a week, alternating with other staff. I'm the only one there at any time, and the custodian cleans it every night. I am cautious because my son has asthma and has not had a flare-up in years. What is my risk of picking up anything? It's a good question.
Great.
So if you're alternating with other staff, of course, we hope that when, things are being cleaned, that it's being cleaned properly and that we have nothing to worry about. But in this time, I would always practice like extra caution. And so, of course, you know, still wear your mask. And like one thing I guess we could talk about that's like, I'm sure you guys know, washing your hands is so important. Like Dr. was saying, is, you know, the virus is susceptible to, I guess susceptible, I don't know. It's
Doesn't like
safer
soap
for
and
you to
water.
use good hand washing techniques, soap, water, and like really get the friction going in there, you know, see those bubbles come up from your hand soap so that you know that it's like really working. And I would just take, you know, extra precautions, because of course you hope everyone's doing their job and trying to be cautious too, but you never really know. And so just, you know, before you touch your face, if you really need to like scratch your eye, go wash your hands real carefully, real, you know, in depth before you do any of that. And, you know, if you
have wipes, take your own wipes and wipe down your computer surfaces.
Yeah, someone was also saying you can take your own wipes and wipe down the computer surface just to make sure you know it has been cleaned, and that's a good idea too. You can take that to work. And I agree with Sylvia, hand washing. I remember when people were buying all the hand sanitizer, and I was like, that's good, but hand washing is the number one way to prevent infection. And you got to do 20 seconds. So singing that happy birthday song, happy birthday to me, happy birthday, then you know that you're getting your 20 seconds in.
Yeah. And you don't realize, you know, everything you touch is with your fingertips. But when you're washing your hands, sometimes we kind of leave those out. And so that's a big thing, is making sure you're like scrubbing your fingers. And I always like scratch my palm of my hand to get under my nails, you know, and I haven't cut my nails in a while. So I have to really dig in there to make sure I'm getting my nails, because you don't realize, you know, if you're just scratching real quick, you know, you may not have been washing your fingers very well, and it could, you know, be spread like that. So just taking those extra precautions, I think. I hope that answered your question.
Yes, thank you.
Yeah.
What about I know a lot of people, especially on the radio, have been saying we should help small businesses by ordering food from restaurants, local restaurants, and picking it up. But is there a risk with the restaurant workers, how they're handling the food, and whether we could get, you know, possibly catch the virus from takeout food? Because we don't know if they're wearing masks or what they're doing when they're preparing it.
There are pretty stringent rules just in general about handling food as a restaurant employee, as far as making sure that you're wearing gloves. And it's true. You would hope that, you know, they would be putting extra on top of that. But with the way that food is cooked, you know, when it's heated, generally that should do the trick. And making sure that you, before you consume it, you know, are doing your duty as well. But I think that the likelihood of getting it transmitted that way is a lot lower than just it being, you know, with direct contact with people.
Okay.
That makes sense. Yeah.
Yes.
And other things you can do is rinse your produce off like you normally would do when you buy your produce if you order from like a local farmer's market. And if you want to take an extra step, if their food is in a plastic container, we've wiped off the outside of the plastic container or opened the container and put it on another plate to eat from it.